Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist practicing at Cloud9 Bellandur and Sarjapur, Bangalore. Ovarian cyst is one of the increasing problems which we can see in the women of the reproductive age group and postmenopausal women. So many times ovarian cysts are dangerous. Why? Because they are diagnosed at a very late stage. Nobody have any symptoms. Patient will tell, doctor, I was not feeling anything. I just came with a little bloated feeling. I was not at all feeling hungry. The son will get his mother telling that my mother is not eating food and she feels little bloated sensation. When we palpate the abdomen, we see that there is a huge mass which is there. When imaging modalities like ultrasound, when we do, we see there is a huge cyst. It can be cancerous or non-cancerous. Need not all ovarian cysts are cancerous. It depends on the size, nature of the cyst. If it is only water filled up to 8 centimeters, we will just observe for the women who are in the young girls. If the same postmenopausal woman has a cyst of 8 centimeter with the uterus internal lining thickened, for them better to intervene surgically. So when we see any patient with ovarian mass, we take the proper medical history, evaluate the medical background and since how long the problem is there, and get the tumor markers. Ultrasound will be done. In ultrasound, we see whether it is simply water-filled cyst or there are solid areas. Solid areas with liquid cystic areas, if it is there, then it is a complex ovarian mass. Complex mass of even 4 to 5 centimeter. There are some masses called dermoid cyst. So those kind of cysts we can observe. If she is 30 years old woman with 3 centimeter, during pregnancy only we see 3 centimeter cyst with dermoid cyst. We just observe those kind of patients. But if the same 3 to 4 centimeter dermoid cyst is there in the postmenopausal woman, we have to operate immediately because they can be cancerous changes can be there. So it depends on the age and the nature of the cyst along with the tumor markers. There are the blood tests which we do. We will know whether it comes to low risk or high risk category. Based on this, the clinical management will depend. Ovarian cysts, when planning for surgery, has to be properly evaluated. Incomplete evaluation and doing the surgery. So many times we get referral patient, doctor, they did the surgery. Initially, they thought it to be normal cyst and they operated. The biopsy shows it is a cancerous things. So those kind of incomplete surgery and incomplete treatment for the patient can be prevented by doing proper pre-operative evaluation. So for that reason, imaging techniques like MRI can be very helpful for these patients to know whether the lymph nodes are enlarged, any tumor spread beyond the ovaries is there, uterus or the omentum, intestines can be adhered. These kind of problems and all can be properly assessed by the MRI before surgery if it is done. So with this, we will know what stage kind of surgery we have to do. Whether we can do this surgery by laparoscopically keyhole procedure or the patient has to be undergone laparotomy. It is an open surgery. So in this way, we can prevent so many complications, incomplete treatment of the patient and post-operative repeated surgeries, because they would have opened and done the surgery, incomplete surgery. Then the biopsy report will come after 1 week telling that it is a cancerous one. Then they go to the oncologist, they tell we have to do the second look surgery and complete uterus, ovaries removal, these things have to be done. So all these could have been properly prevented by proper pre-operative evaluation. So always go to the doctor where proper setup, everything is there and proper evaluation is to be done. And ovarian cyst, even if it is a small simple cyst which is done for the young unmarried girls, that biopsy report you have to save it properly, because she was 10 years old, doctor, that time some simple cyst was there, so that was operated. We don't have the operative records, they tell. The same woman, when they come with the pregnancy, we don't know. Sometimes this clinical data will help us, because so many people with the ovarian cyst, they would have taken out the tube also. So people will be thinking why she is not conceiving, but tube only is not there on that side. So these kind of things, operative records and keeping the biopsy reports, these things for lifelong, that has to be properly managed. And ovarian cysts when treated properly and for proper follow-up with the doctor is very important, because if it is a cancerous mass, after chemo radiation they have to follow up regularly. And whenever ovarian mass is there, ovarian cancers are there, they have to see in the family also. Some tumors can be familial cancers. Along with that, breast, uterus, ovarians and the intestine cancers also can be there. So always yearly annual health checkup is the best way for diagnosing early ovarian cysts, because annual health checkup your corporate will be giving. As such, for our own health sake, we have to get it done. So any cyst, if it is there, if it is a simple cyst, you can wait. If it is a complex cyst, it has to be properly evaluated and immediately treated. Don't let any solid ovarian masses stay for a longer time. That will cause problem. But a simple cyst less than 5 centimeter you can observe. Premenstrually, if we see, there will be a small cyst will be there. After the periods, it will regress on its own in the reproductive age group. But the cyst in the postmenopausal woman has to be given and treated immediately. So manage important is to meet the doctor, properly evaluate. The doctor will tell this patient can be observed, this kind of ovarian cysts or the tumors has to be operated immediately. Based on proper evaluation and management, the quality of life will be very better for the ovarian cancers also, because in stage 1 if it is treated, the quality of life will be very good. So because the most ovarian cancers are diagnosed in the late stage because ignorance and not getting evaluated properly. Even in modern era, women are scared for going for pap smear, cervical cancer examination, tests, things and all. They feel shy or they are scared for the internal examination. Those things should not be done. Get evaluated properly, annual health checkups and self-breast examination. These kind of preventive health is very important for the woman. And any woman, if you have any kind of problems, if you are having the problem, they don't be hesitant to discuss with your family members, your children. The old age woman, they feel my son is so tired, they don't have time. Don't be reluctant and don't hide the problems. So express it to the family, meet the doctor so that it can be early treatment. 100% cure will be there for ovarian masses and better quality of life will be there, because they think that they are giving burden to the children. It is not like that. Mothers who have taken care of us when we were children, they are not burden to anybody, because ovarian cancer is the most common cancers which can occur in the late age group. So you have to annually health checkup has to be done and get it properly evaluated by the doctor for better quality of life and good outcome of the treatment. This will help you all.